Well, thank you very much, everybody, for coming. This is a great turnout on a really helpful, I hope, topic so that you all can utilize it if you need to during your day for yourself or a caregiver or maybe a friend that might be experiencing some freezing. Okay? So I'd like to tell you a little bit about some problem-solving strategies for freezing episodes and individuals that have Parkinson's disease. So what we're going to talk about today is what is freezing? Why does freezing happen? Where does it happen? Some strategies that hopefully you'll be able to use to move out of freezing, strategies to help keep freezing from happening, and then what treatment is available for other additional assistance. All right, so just a review on Parkinson's. It's been Parkinson's month. We've been working on looking at Parkinson's a lot closer this month. But just to review, Parkinson's disease is characterized by a substantial loss in the dopaminergic cells in the substantia nigra. That's a part in the brain which plays an important role in movement. Okay? Parkinson's can be associated with these motor difficulties, and we like to think of it as the mnemonic word TRAP. Tremor, rigidity, akinesia, which can be also bradykinesia, a slowness of movement, or like a dyskinesia, which is more of a faster movement, or hyperkinesia, and postural instability, so TRAP. Now, not everyone with Parkinson's disease will experience all of those symptoms either at once or one period of time, okay? And although not occurring in everyone, freezing does happen in individuals with Parkinson's and is an independent feature of Parkinson's disease. So what is freezing? Freezing is an abrupt difficulty in standing starting or continuation of movement, and it's rhythmic or repetitive movement. You'll get this feeling of feeling frozen to the ground or glued to the ground, but your top half wants to go. But sometimes you can actually feel a frozenness in your hands, your arms, your upper body too, not just your feet. The different types of freezing, although they occur at different times, which I'll show you in a moment, you have a start hesitation. So when you want to get up and go out of the chair, or when you want to start and take a step, that's that hesitation where you might feel a trembling in your legs or a shuffling in your feet, this shaking almost. That's different from a tremor. Or you might have a sudden stopping of stepping or partway through the mobility task, whether it's walking or standing up. And then having a start hesitation actually during a motor block, the blocking of that motor movement. It also occurs when something interrupts the normal sequence of movement too. So you may be more at risk for more freezing if you're in a busy environment, if you're doing dual tasking, multiple tasks at once, if you're stressed, if you have something on your mind that's stressing you, or if you have pain. A lot of those things will also cause freezing. So in your notes, I've provided for you 2 links of some examples of freezing, okay? And if you would, on your own time, just take a look, just for the sake of time today, because I really want to get through the strategies. Take a look at some of these videos here. They show 2 different individuals that are experiencing freezing during their normal daily activities. So some facts on freezing: about 30% of individuals with Parkinson's disease at some point encounter difficulties with freezing. Not everyone, and I was telling another woman before that sometimes you have freezing more at the beginning stages of Parkinson's disease, sometimes more in the mild or moderate stages, or sometimes in the later stages. So not everyone experiences this. Freezing does occur during the start hesitation, okay, which most of the time that does occur. It's 86% of the time. With turning. Turning is about 63% of the time. Initiating walking, about 23%. Narrow spaces, 12 to 25. That reaching the destination just before you're about to sit down in the chair, you have the freezing. But oftentimes, this varies for individuals, okay? Some people might experience it more when they want to try to walk into their walk-in closet, or every time they want to go to sit down in their favorite chair in their living room, they always, even though they got their mind on that chair, they always get that freezing right before it. So it varies per person. And then those with freezing may actually also experience a delay in speech initiation. So if you are, just a side note, if you are experiencing that, I would definitely talk to your healthcare professional, whoever you're working with at the time, whether it's your physical therapist, your occupational therapist, your neurologist, definitely. I'd talk to them about those concerns. And then too, interesting enough, that this is actually a symptom that's less responsive to Parkinson's medications, that dopaminergic medications. So that's why I want to show you these strategies today so that you can maybe learn, but then also go see a PT or an OT to be better at those strategies so you have less risk for falling. That leads us into the dangers of freezing. It is unpredictable. We don't know when it might happen, but somebody like myself or one of the other therapists upstairs, or also your caregiver, you can observe these techniques or these reasons why you're freezing and be able to know what causes it. It is often preceded by frequent small steps, what we call festination, when you start walking and you get going faster and faster and faster and you just can't control yourself, okay? Or like a leg trembling. Maybe you're trying to step and your leg just wants to tremble like that. Just can't get that foot glued from the floor or unglued. It's a loss of automatic movement, which means that the person has to think, consciously have to think of that activity, which if you have to think of an activity and then you're trying to do two different things at once, that challenges that other activity that you want to do. So if you were going to go into the kitchen, grab yourself some water, pour the glass full of water, and then turn around and go back, imagine how that might increase your freezing, right? Because that's multiple steps of the activity that you have to do. The more risk, the more things you're doing at once, the higher your risk for falls is. That's what we really focus on in PT. And like I said, this is linked to injuries, falls, and decreased quality of life, with no one here at this clinic and no one here in this room wants that at all. Okay, so some more dangers of freezing. That with Parkinson's disease, when it progresses, posture and balance changes do happen. And with freezing, when you're freezing in this posture, that then links to falls, more risk for falls. So the body can become stooped, the knees become more bent, your head becomes more forward and looking down. So now your weight is more on the tips of your feet. So then if you have that quickness of your toes, you have a hard time controlling your body, your center of gravity going forward, which then could lead to a fall. Okay. So what causes freezing? It's actually unknown. We don't know why. But there are sudden signals that go to the brain, but it's already a dopamine depleted system, right? That's where the movement system is. And if those neurotransmitters are depleted, then you really can't move quite as well as others who may not have this concern. It can worsen in the person if they're feeling anxious or stressed, like I mentioned, if you're in an unfamiliar situation, or if you lose concentration on that task, having to consciously think about that task. And then also when that switch from autopilot is disrupted. So some situations that trigger freezing, you may experience this when you're walking through crowded environments, when you're turning corners, turning around in a circle, in narrow hallways and spaces like church pews, theater aisles, bathrooms, closets, stepping in from one surface to another, from tile to carpet or a curb to the street, walking through doorways over thresholds or elevators, divided attention and distraction, and then also that multitasking, whether it's a motor task, carrying that water in the kitchen, or having a conversation with somebody. Now, freezing can actually also happen when you're driving. You can be slow to move or freeze entirely, which can definitely affect your ability to turn the wheel, move quickly to avoid obstacles in the road, pushing down the brake pedal or the gas pedal appropriately. Okay? We do, just a side note here, in occupational therapy, we do have a driving simulator as well. So at one point, probably in the future, occupational therapy will be talking about that more. But that would be, along with talking to your healthcare provider, would be very important to help you and other people on the road stay safe. So has anybody ever heard of on and off phases? Okay. Freezing during on and off phases. This is what I'd like to talk to you about now. The on and off phenomenon is a quick, unpredictable reappearance of Parkinson's disease symptoms. This could be stiffness, slowness, tremor, the freezing, or maybe it's anxiety or nausea or depression. On the off phase, it's a period between the Parkinson's dose, so when you first take that dose, and then it kicks into your body about 30 minutes later, you may notice during your on phase that you're moving better. You're walking better, you're feeling less stiff through your arms and legs, your posture is better. But then if someone typically had a 4-hour dose, during the off phase would be closer towards that next period of time when you have to take your medicine again. So if you're getting to, like, sometimes it happens earlier in people, sometimes it happens later. Just all depends on the dose of that medicine and then how our bodies what's the word? Looking for, how are they reacting to the medicine? Looking for but anyway, Susan. But anyway, so that off period is about maybe an hour before your next dose, maybe 45 minutes, maybe 30 minutes. But that's when you might notice that the freezing is happening more, your posture is changing, maybe you're having some trouble speaking or swallowing, you're feeling more stiff. So that's the danger of that off phase, right? But this phenomenon can be tough, right, to experience, but there are individuals like in physical therapy and occupational therapy, and then also talking to your doctor about when you're experiencing those off phases, maybe, if it's appropriate, you could change the schedule of your doses, okay? You really want to be right on the money about be strict about your schedule, about taking your medicine. So, for example, if you take it at 8, 10, 4, and then 8 o'clock, you really want to be right there because that's when that off phase could happen. And if you're out and about with your friends at lunch, right, and then you have that off phase right before you go to lunch, that's when you might be having more trouble moving about. So you really want to be strict on that schedule. But if you're noticing this happening more often during a certain period of time throughout your day, maybe think about switching up that activity if you could do it at a different time of the day, or talk to your doctor about switching your dose schedule a little bit. Maybe you start at 7:30 versus 8:30, and then you take your next dose at 11:30. Just an example. It may not be appropriate for everybody, but just an example. Okay. I mentioned to you a little bit about how the on and off phase is treated. Okay. If it continues to be bothersome, like I have here, talk to your doctor, and then also talk more about to PT and OT. But I have some more specific information on that slide for you that I already discussed. Also, too, on your own time, if you would, just take a look at an individual experiencing this on and off phase. In particular, this first link that I provided, there's a gentleman that's experiencing this off phase, and what you would see is him stoop down, his shuffling and freezing really occurring, and then about 30 minutes later, after he's taken his carbidopa levodopa, he's more up tall, he's taking long strides, okay? Sometimes, after about 30 minutes, but it varies per person. Okay, so take a look at those videos on your own time. So with that in mind, I want to share with you some other indications for physical therapy, but also, too, it could be a great resource to go to occupational therapy as well, and I'll tell you that here in a moment. So if you're, yes, oh, sorry. If you're experiencing freezing, or maybe your freezing episodes have increased in frequency, if your balance becomes more unsteady and falls occur, or maybe near falls, if that countertop wasn't there, would you have fallen to the ground? If your sofa wasn't there, would you have fallen to the ground? Okay? Increased difficulty with daily activities, increased difficulty with work activities, increased sedentary lifestyle due to difficulty not being able to walk quite as well, and most importantly, a decreased quality of life. We are here, we want to help you. So what will physical therapy provide for you? A skilled physical therapist will complete a full evaluation on these things. We'll take a look at your walking. We'll ask you specific details of what may you have noticed, what triggers your freezing. Some of those triggers like we talked about, right? Walking around the house, okay, in and out of your bathroom, in and out of your closet. We'll provide for you a falls risk balance assessment. We'll also take a look at your daily activities and how you are performing those. And occupational therapy will look at those even closer, more so than PT. But it's going to be important for us to know as well. We're going to give you and provide for you education and training to help you decrease freezing. And then with that, it's also really important to be able to provide that information to caregivers too. Because there are going to be times, which we'll talk in a moment, where your loved one with Parkinson's is having a freezing moment and might need some guidance, appropriately, some guidance to be able to get out of that freezing moment. And then also too, help you with education and training on balance, strengthening, working on your walking, transfers, and other daily activity performances. So how can PT and OT help when freezing occurs? I want to talk to you about visualization with mental practice and guided imagery. I want to talk to you about a weight shifting technique, visual cues, using visual cues and auditory cues to help you, relaxation techniques, using assistive devices if it's appropriate or other technology, using caregiver assistance, and then also having some home modifications that might make it safer for you to walk around your house. So first, let's start with that weight shifting technique. Okay, now on your slides, I provided you for more details. Okay, but remember too, we know that freezing happens when you're doing a dual task, when you're in a busy environment, maybe when you're experiencing pain or stress. So if and when that happens, try not to fight it. Just stop for a moment, okay? Take a deep breath and think. Weight shift. Left, right, and it helps. You may feel kind of silly doing it, but it really does help saying it to yourself out loud. Saying left, right, and getting your body, maybe you start here, okay? Then maybe you get a little bit bigger. Try to get it in your knees a little bit more. Okay, really get your knees going. Now try to start getting your heels going. Left, right, and as you start getting bigger, find a spot in front of you to try to step to, okay? And then 1, 2, 3, go and take that step. But if you have another freezing moment, just start again. Pause, deep breath, and then just repeat that cycle, okay? Yes, sir, Jerry.
I've never had a freezing moment. One thing that concerns me is I'm still driving. If I should have a freezing moment while at the wheel of the car, what should I do first?
Right. So Jerry had asked if he had a freezing moment while he was driving, what should he do? What should he do? I would definitely, and I don't know because it's so unpredictable and there's so many different things going on, but I would do whatever you can to make sure that you're safe in that car. So if you did have it, try to relax, try not to panic, okay? Try to relax, take a deep breath, slow down as best as you can, and then get over to the side of the road and maybe consider trying to call somebody to come and help you with that. And then take a look at your watch. Are you supposed to be taking your medicine? Did you forget your medicine? You know, and then consider if you did forget it or you're close to getting it, just wait there and maybe wait that 30 minutes at least for your medicine to be kicked in. Okay, and maybe that'll help. But in all, I would really talk to your doctor about it though, okay, to be safe. Can I answer some other questions afterwards too, Jerry? Is that okay?
Sure.
Thanks. Hold that thought because it's important. We've got some visual cues I also want to talk to you about too. So it can help you take a longer step and help with not freezing quite as much. If you take a look here on the left side of the screen, you can, if you have freezing when you're approaching the doorway, actually the research says that individuals without Parkinson's see the doorway the normal width. But individuals with Parkinson's may actually see the doorway more narrow. So if you're already freezing when you're trying to walk through the door, and then those people have freezing when they're trying to get through the door, it's going to make freezing even more, right? So you could actually put tape down along through the doorway, just like in this picture. The stripes placed through the doorway. So that would give somebody a visual cue to step to. As you're walking, try to step along those pieces of tape or whatever it might be. Maybe it would be through into your porch. Maybe you use some paint. That would be a contrasting color of the carpet or the tile or whatever the flooring might be, so that it's not all one color flooring, and you would be able to focus on that target to help you safely step through. You could also use some laser lights, which I'll show you in a moment too. And then visualization. Think big as you're trying to step. Maybe use a weight shifting technique. Think big movements as you're weight shifting, and big step as you're looking down on a particular spot. Try to step to it and walk through. Focus on getting through that door. Think positively. So auditory cues can also be helpful. You can get feedback through your ears and hearing to establish a rhythm or stepping to the beat. For example, maybe you like to listen to music already, and maybe you want to turn on some marching music or kind of hum or whistle a marching song, or maybe your caregiver would sing that out to you. Maybe you have this marching song in your head that gives you the beat of that shifting left to right, or maybe you start marching in place, which then might help you be able to get through that freezing episode. And like I showed you before, counting or singing 1, 2, 3 step. Also, in physical therapy, we use a metronome. Metronomes can help getting synced to that beat, to that rhythm. And counting out loud may also help you get through that trouble spot, get through that doorway, or getting to the car safer. I'd like to show you or talk to you a little bit more about some information on guided imagery and mental practice. And the ladies of occupational therapy had given me this information. So this can actually help you with preventing the start hesitation too, but also just help you be in more relaxed mental imagery and helping you get through that period of freezing that you know that you might have later in the day. So first, if the initiation of movement is a problem, visualize yourself completing the action in your mind. Imagine yourself doing the actions in detail without any difficulty first. Prior to getting started, go through that step by step in your mind and thinking about how, whatever that might be. So let's say you have to walk into your bedroom, and every time you turn the corner down the hallway, that's when you're having the trouble, when you're having the freezing. So think about it. First, there's nothing in the hallway that could be distracting. There's nothing in the hallway that I could potentially trip over. Good. There's good lighting. Check. Okay? Now go through it step by step. I'm going to walk through the hallway, and I'm going to take big steps, and I'm going to visualize me successfully making through or coming around that turn and going right into my bedroom. Okay? Prepare for the action with a 1, 2, 3, go, or whatever strategy might be helpful for you, whether it's the visual cues, the marching, right, singing the song in your head, and then followed by that, try to imagine yourself doing those actions. Some other information on guided imagery and mental practice. We've got some resources here on the bottom of your slide there. I would encourage you to go through those and take a closer look. They're really helpful. It's a gentle but powerful technique that focuses and directs the imagination in proactive and positive ways. So I would encourage you, when you use this technique, try to see yourself being successful, saying, oh, I know when I come to that, I'm going to freeze. I'm not going to do this. I'm not going to do that. Try not to do that. Try to be positive and seeing yourself successfully walking through that doorway. In a 2009 research study, there was actually an article that used relaxation and guided imagery that did help with freezing and with tremor. So picture yourself, picture your week ahead of you. And what does your week include? What activities have you noticed causing freezing in the past? But then picture yourself moving throughout your week, being successful with those activities. Okay? And like I said, this is a really great technique that occupational therapy uses, and it would be really great to have you all go through that more in depth with them. But those resources there are for you to take a look at. Let's look at relaxation, breathing, and meditation. So using techniques when you experience anxiety during functional activities may assist with you optimizing your movement. These techniques include deep breathing, imagery like we talked about, and then progressive muscle relaxation. Progressive muscle relaxation is an exercise that reduces stress and anxiety in your body by having you slowly tense them and then relax them. And this link here actually has a really wonderful video of a woman that has a central tremor in Parkinson's disease. And she goes through about a 30-minute video on how to do these relaxation and meditation techniques. She takes you through step by step. So you could just pull up your computer, go onto YouTube, put the link in, and go through that to help teach you yourself some relaxation techniques that you might be able to use throughout your day as well. So let's talk about some assistive devices, and keep in mind some of the assistive devices that we're going to talk about aren't typically the rollator walker or the cane. You can use some other things like the metronome, where you might have a metronome on your cell phone or your pocket, okay, or in your pocket, and you can use that whenever you have freezing to help you get through that freezing moment. I'm going to show you a couple other things too with lasers and some other canes. So first, this metronome, it'll help you synchronize your stepping cadence. With a physical therapist, you could also try to find that particular cadence beat that would be appropriate for whatever activity that you're doing. So we could help you, we can simulate that activity and help you find that beat to help you get through the freezing episode. It can be used when walking around the house, walking outside for exercise, walking on the treadmill, whatever it might be. The retail price of these, you could get them on your phone for free, or sometimes you can get, or you can also get them at the music store for about $20 or maybe even cheaper online. This particular metronome, the Peterson Body Beat metronome, actually has a speaker and a vibration piece to it. So anytime you're freezing, you'll be able to actually feel that vibration into your hip, and it could help you get that sensation, that feedback to help you get going. I've never actually used it before, but there are some research articles that have used it in the past, and that they did have some success, those individuals. This costs about $100. And in physical therapy, we also have a U-step walker. And this U-step walker, it's similar to a rollator walker, but it's actually different in the way that the brakes work. So you have to, if you take a look at the very top where that star is, you actually have to squeeze the handles to make it go, okay? And then when you want to stop, you release the handles. But right where that star is, there's a little button. If you press the button, a laser light shines on the ground, just like the other picture shows, and that could be a visual cue for that person to step to if they needed a walker for safety. You could click that button or have it on at all times and have that as a cue to step to when they're freezing. Now, we don't necessarily want to encourage you to look down all the time, right? We want to look up, so that helps our posture, helps prevent falling too, okay? But when you're freezing, it would be good to maybe consider using that as a visual cue. The laser cane also has that too. It would just be a cane with a little button on there that has a laser, just like I show you there in the picture. This one costs about $275. I think the other one costs, yes, it's about $800. You might be able to get these provided for you through insurance, but that would just depend on what type of insurance you have, or maybe a secondary insurance too. This one, the Agilitas, said that wrong maybe, but I think it's out of Australia. And this is actually a little piece that you would hook to your belt buckle, and it has a laser light that points forward. That could also be used as a visual cue for you to step. This costs about $2,000, so it's not very cost effective there. But maybe if you're pretty handy with a little cat toy laser, you might be able to jimmy rig something up that could help. But otherwise, maybe you can come to PT and we can help you with another thing to use. But in the research, it has helped some individuals with Parkinson's. Another device that's out there too, although I've never used it before, is called the Next Step Walking Aid. And this actually is a cane that has a little piece that comes out at the bottom that would serve as a visual cue to step over. My concern is that if you're having freezing, you could actually trip over that, right? So just keep that in mind. Everything that's out there may not be appropriate for you and may not really even be safe. So I just caution you with that. So however, using aids inappropriately or walkers and canes just in itself may actually increase somebody's freezing, because we know that freezing does happen in narrow, tight spaces, closets, or crowded environments where lots of people are around. So if you typically have freezing when that happens and you had a walker in front of you, that might actually encourage your freezing. So we definitely don't want that, right? But maybe there are some other strategies that you could use to help with preventing freezing if you did have to use a walker. And that's where we would come in upstairs. So I want to share with you a couple of things that you can do as a caregiver during freezing. So first, you want to help the individual remain calm, okay? It can be very uncomfortable and worrisome when you're having a freezing moment. You really want to try not to rush the individual, and you don't want to push them through this freezing episode. You want to wait patiently for several seconds or however long they might need, and to see if maybe this freezing episode will pass. If they're unable to move, try to encourage them to use one of those cues that we talked about. Maybe you first start with weight shifting, trying to get their feet moving, okay? And you can stand there, remember not too close, but stand there to be a guard if you needed it, to help them stay safe from falling. Then you also too may be able to, if they don't mind, to gently assist them at their hips, right behind, just to help them get that weight shifting going, okay? But really, all in all, you want to encourage them to use that cue by themselves at the beginning, but help them through it, help them try to be successful. And then over the next couple weeks, see if you can take the cue away and not help them quite as much, but encourage them to be successful with that cue. Because 6% of the people that have Parkinson's and use a cue that we have given them 100% of the time, use the cue and actually are successful with it. Not very many people that use that cue successfully. So if we continue to give it to them every time, when we're not there, they may not be able to use that cue because they would have needed your help. So that's what we can teach you in physical therapy, to use that cue appropriately and to give the caregiver some guidance in when it's appropriate to use it, but then help that individual with freezing use it appropriately and be successful on their own. So what else can we do in physical therapy to help you with freezing? We work on high amplitude movements. This helps with multiple things with people with Parkinson. It helps with moving big. It helps with decreasing rigidity. It helps with your dynamic balance. It helps with lessening freezing too. We call it big or power. Also, dancing in the research, and specifically tango, has helped with decreasing freezing because of the rhythmic staying on the beat and how you have to move to the beat. So if you used to dance a lot, get your dancing shoes out with your partner and go practice. Treadmill training we do too. Gait training with an assistive device if it's appropriate. Movement strategy training to be able to teach you to use those cues that I spoke about before. Strengthening and flexibility, definitely. Balance training, postural education, and then even Tai Chi can help you with your balance and flexibility, and also relaxation. So I have in your slides too some other strategies. I'm not going to go through all of them in depth, but there's some other strategies that you can use. We'll go through a little bit, but I would really encourage you to think about, if you're having freezing during these situations I'm going to talk to you about, to really talk to your doctor about coming to physical therapy. Okay? So first, unfreezing strategies for turning when you get to the chair. So you might notice that when you're turning, get to the chair, you try to turn in place, right? If you turn in place to get to the chair, that's when the freezing might happen. So if you use a strategy like this, like if you had to walk in a semicircle, or like if you were making a U-turn, right? So maybe you come up to the chair, but from the side. You go out to the side a little bit and come around so you can continue that free-flowing movement, and then you can turn. So you're not turning in place. And when the turning in place happens, that's when you're freezing. So next time if this happens, try to use this strategy just like in the picture on the right-hand side, going wide around and then coming up to the chair. Freezing in busy places. What you can do is try to go step to the side, just inside of the doorway or out of the main flow of other people. Allow time to pause and look at your environment and try to plan out what route you're going to do. Look for obstacles, children, grocery carts, curbs, uneven surfaces, whatever you might encounter, and then decide the safest route, the exact route that you're going to do to help you be successful to get there. And then repeat as if anything changed. Okay, and then you can use some of those techniques, whether you weight shift, you do visual cues looking down, maybe there's lines on the sidewalks that you can try to reach towards or step to, or maybe you sing that song in your head that will help you continue your continuous flow of stepping. Then we have some unfreezing in and out of the elevator. So same thing. You try to use that wide turn or the visual cue of stepping through over the little elevator spotlight line, right? Stepping over it, using that as a visual cue, and then instead of turning in place inside the elevator, use a wide turn, go around to the outside, and then turning, then being able to stand wherever you want to into the elevator. And you can do that in your walk-in closet as well. So unfreezing strategies for car transfers, you can use visualization and mental practice. The weight shifting strategies, moving from sitting to standing, and then also getting into the car. The doorway is quite narrow too, right? So you might have some freezing during that as well. So just try to use some of those weight shifting techniques. And even when you're sitting in the car, if you have a hard time lifting your feet out of the car, you can weight shift, slide to the edge to help you weight shift and then turn, and then be able to get your weight shifting going while you're sitting, and then be able to stand up safely. The caregiver in that case can also make sure you have the assistive device there, or just be there to help you, guide you through it, maybe talk you through it if you need to. Some unfreezing strategies for bed mobility would be to use rocking with your arms and your legs while you're laying down to help you gain momentum and initiate that roll. The caregiver can assist you with positioning, initiation of the movement, and then also just to make sure that you're safely there through the whole transfer. So those are just some examples of how to help you with unfreezing. Again, we can always go through that more specifically in physical therapy and occupational therapy. But I want to show you some home modifications too. First, you want to make sure that your doorways are a contrasting color. Maybe you put those tape lines down or some paint or a different type of tile or carpet there. Definitely consider removing any floor rugs. They're unsafe anyway because you could trip over them. So definitely put the little tacky stickers on the underneath the floor, but maybe just the floor rug, but maybe just consider getting rid of them altogether. Consider plain colored flooring instead of busy designs. So if you have lots of intricate details on your carpets or rugs, maybe consider getting a different design for that area. Remove clutter to open up the rooms, especially tight spaces. Use the visual cues like the tape for assistance to help you with the step length in those problem areas. Keep the rooms and hallways well lit and minimize any uneven surfaces that you might have throughout your house. So in summary, when you're freezing, stop. Calm yourself, take a deep breath, and then think about in a positive way how you're going to be able to get through and do that action. Plan what you're going to do and then try to complete that task as safely and as successfully as possible and with confidence. And then if it doesn't work necessarily, try it again, see what you can make better the next time. When trying to implement the strategies a little each day until they become automatic for you. Retrain your brain, that's the most important thing here, and that's what we can help you in PT and OT. Encourage yourself to need less cues and use less assistance from the caregivers, and that'll help you do it on your own. And then consider coming to physical therapy and occupational therapy for more in-depth training that might be even more appropriate for you to find out what strategy works for you or your loved one. Okay. Thank you very much. I appreciate it.